Bioresorbable plates and screws and their clinical applications. Well, speaking of bioresorbable materials and their clinical applications, we know that the metal implants have been the traditional tools for internal fixation in orthopedic surgeries for years. Despite this, a consistent set of problems such as breakage, stress shielding, etc., have continued to prevail. Hence, with evolving technology, a number of bioresorbable polymer devices have recently become available to create a viable alternative for such problems. These bioresorbable materials are gradually dissolved in the body. However, this has engendered a problem. The most limiting aspect of bioresorbable polymers is their inherently lower strength compared to metals. Although it poses an issue with some materials, significant tissue reactions have been observed in some cases as well. Our group has made an attempt to discuss this field of bioresorbable materials and their clinical applications through this presentation. The human bone is a composite natural tissue comprising of about 30% matrix, 60% mineral, and 10% water by weight. The bone matrix is comprised of collagen, which is responsible for its tensile strength. In orthopedic surgery, bioresorbable implants have been mandated to avoid the implant removal operations. Pins and screws made up of PGA have been widely used, while a variety of PLA implants, including pins, rods, tacks, screws, and plates, are available. Retained metallic implants are always at the risk of endogenous infection. In addition, metal plate screws might lead to destruction and osteoporosis in the surrounding bone tissue. The prime advantage of bioresorbable materials is that they provide initial stability adequate enough for healing and also allow gradual resorption after biologic fixation has been achieved. The implants are initially subjected to considerable loads, which gradually decrease with tissue healing. The perfect implant will degrade at a rate that gradually transfers load to healing tissue and does not outpace the healing response. Modern bioresorbable materials have been primarily polymers of polyalpha hydroxy acids in the polyester family. The materials mainly used comprise of polyglycolic acid (PGA) and polylactic acid (PLA). The first study concerning biodegradable materials used for implantation was presented in 1966 by Kukri et al., who studied the biocompatibility of poly-L-lactic acid (PLLA) in animals. The material was found to be non-toxic and gets naturally degraded. There are many companies associated with the bioresorbable material industry, and a number of devices and implants are commercially available. Bioabsorbable fixation for the attachment of soft tissue to bone is being increasingly utilized by orthopedic surgeons, particularly in the treatment of soft tissue lesions in the shoulder. To perform successfully, implantable biomaterials must not cause abnormal responses in local tissues and should not produce toxic or carcinogenic effects. Biodegradable materials in particular should serve their intended function while releasing products of degradation that are biocompatible and do not interfere with tissue healing. The limitations of biodegradable implants are mainly in their mechanical properties, which are lower than those of conventional metal implants, leading to low confidence levels regarding the stability of reduced fractures. I would now like Samrat to continue beyond this.
Thank you, Shrishti. Now, let's study the variety of bioresorbable materials. Bioresorbable materials are those materials that upon placement within the human body starts to dissolve and slowly gets replaced by advancing tissues such as bone. The primary metals in this category are magnesium-based and iron-based alloys, although recently zinc has also been investigated. Common examples of bioresorbable materials are tricalcium phosphate and polylactic acid copolymers. Ceramics. Calcium phosphate. Calcium phosphate are white chemical compounds found widely in the Earth's crust. It's white solid, unless doped, having the properties similar to the inorganic part of major normal and pathologically classified tissues. It can be both bioactive and bioresorbable. In biotechnology, this compound can act as a chemical binder for chemical bonds with surrounding tissues as well as providing a good stability. Beta TCP, also known as beta tricalcium phosphate and HA hydroxyapatite, are some of the common calcium phosphate ceramics. Beta TCP is biodegradable and able to promote osteogenesis and new bone formation. HA is highly crystalline and is the most stable and least soluble calcium phosphate ceramic in an aqueous solution down to a pH of 4.2. With a lower resorption rate of HA 1 to 2% per year once implanted remains integrated in the regenerated bone tissue, whereas beta TCP is completely reabsorbed. Although calcium phosphate ceramics have low mechanical properties, by certain doping of bioinert polymers an optimized property can be attained with better bond formation and accelerated fixation of implants. For example, CAP poly D-L lactide copolyglycolide composite biomaterials exhibit good adhesion onto human cells, indicating a high level of biocompatibility. Previous studies state that composite material consisting of PLLA TCP or PLLA HA showed a rapid resorption and replacement by newly formed bone tissues. Certain ceramic alterations can even lead to a change in the elastic modulus of human, as it is known that the match of elastic modulus between implants and the human bone favors the evasion of stress shielding and the subsequent bone absorption. Now, handing on the presentation to Rishabh.
Thank you, Samrat. Now we will talk about bioresorbable polymers. So, what is it? We know bioresorbable polymers or degradable polymers are polymer materials which can be safely absorbed by the body so that the materials from which a construction is made disappear over time. So, we are encouraging this faster bone healing with orthopedic medical devices which are engineered to have mechanical properties to match the natural bone and minimize stress shielding. For some bone fixation medical devices such as interference screws, suture anchors, and fracture plates, composite materials with osteoconductive properties can provide the perfect biomaterial solution. Among them, we have PGA, PLA and their copolymers have received the most attention in part because they can be self-reinforced to achieve better stress strength properties. Their continued development can be attributed to advancements in novel synthesis techniques, processing technologies, implant design development, and innovative surgical techniques. This has resulted in growing interest for us these materials in regenerative medicine and patient specific treatments in the orthopedic space. Now, let's move on to the next slide. We have PGA, also known as polyglycolide or polyglycolic acid. It is a biodegradable thermoplastic polymer and the simplest linear aliphatic polyester. It can be prepared starting from polyglycolic acid by means of polycondensation or ring opening polymerization. PGA is semi-crystalline aliphatic polyester with a glass transition temperature of 35 degrees Celsius to 45 degrees Celsius and a peak melting temperature to 220 to 233 degrees Celsius. PGA possesses excellent mechanical properties, specifically the highest elastic modulus of 6 to 7 GPa in comparison to other bioresourceable synthetic polymers such as PLLA, PDLLA, and PCl. The Tg of PGA is higher than the ambient temperature. However, its Tg could be lowered due to water absorption in body environment when it is inserted as an implant. Next we have PGA sheet in treating oral and oropharyngeal cancer, as you can see in the slide. Recently, a PGA sheet was used with fibrin glue as a sealant to prevent air leakage during thoracic surgery, to minimize the incidence of concurrent bleeding and pain and to achieve good function after transoral tumor resection for oral cancer, primary closure, free skin graft, etc. This technique was also helpful in reducing oral mucosal defects which need to be covered with a PGA sheet. To avoid strong contraction and oral dysfunction, the mucosal defect of the floor of the mouth was not sutured but was covered with a PGA sheet. What was the result? There was no case in which the PGA sheet detached early. The duration until the removal of the PGA sheet was independent of the use of fibrin glue. Oral nutrition was started on the first or second day in all patients. No post-operative bleeding was noted. Patients with oral pharyngeal cancer who used a PGA sheet reported a significantly low frequency of a single painkiller use. Thank you. Now I would like to pass it on to Rahul and Shomudip.
Okay, so now we will talk about polylactic acid or polylactide. So what is PLA or polylactic acid? Polylactide or PLA is a thermoplastic polyester backbone whose molecular weight varies from 1,80,000 to 5,30,000. PLA is obtained by condensation of lactic acid with loss of water. That's why it is called as polylactic acid. PLA can also be prepared by ringing opening polymerization of lactide. PLA is basically a 35% crystalline polymer which is considerably more flexible than polyglycolide. But one disadvantage of PLA is it loses most of its strength within 6 months due to hydrolysis of the ester backbone. But we can obviously adjust the loss of strength simply by combining different ratios of optically active isomers. At present, PLA has become one of the most popular material all over the world due to it being economically produced from renewable resources. It is also now become one of the most widely used plastic filament material in 3D printing. Now I would like to pass it on to Rahul.
Thank you, Sumandeep. Now let us see some of the properties of PLA. Let us start from chemical property. Due to the chiral nature of carboxylic acid, several distinct sorts of polylactide exist. PLLA is that product resulting from polymerization of L-lactide, as you can see from the figure shown. PLA is soluble in solvent, hot benzene, tetrahydrofuran, and dioxane. Now let us move to the physical and mechanical properties. Physical and mechanical property. PLA compounds vary from amorphous glassy compound to semicrystalline and extremely crystalline polymer with the glass transition from 60 and up to 65 degrees Celsius, a melting temperature from 130 to 180 degrees Celsius, and the tensile modules a pair of zero point 0.7 to 16 GPa. Now let us go to the next slide. Heat resistant PLA can withstand temperature of 110 degrees Celsius. Biodegradation of PDLA is slower than for PLA thanks to the upper crystallinity of PDLA. The melting temperature of PLA are often increased by 40 to 50 degrees Celsius, and its heat deflection temperature are often increased from close to 60 degree to up to 190 degrees Celsius by physically mixing the chemical compound with PDLA. Now let us go to the organic solvent for PLA. Organic solvent for PLA. PLA is soluble during a range of organic solvents. Ethyl acetate, thanks to its simple access and low risk of use, is of the most interest. PLA 3D printer filament dissolve once soaked in ethyl acetate, creating it an helpful solvent for cleanup 3D printer extruder heads, or removing PLA supports. Now, I like Sumandeep to continue the presentation. Thank you.
Thank you, Rahul. So let's see what are the applications of polylactide. One common application of PLA is it can be used as a packaging material. Now PLA has become one of the most used packaging material because it is biodegradable, and that's why PLA is also called as green food packaging polymers. Except that PLA is used as feedstock material in desktop fused filament fabrication 3D printing. PLA is also used as medical implants like screw plates, pins, rods, and mesh. PLA is used in shrink tunnels as it shrinks upon heating. So the demand of PLA has increased so much nowadays that we are finding every possible way to use it as a material, and because it is a biodegradable material, it does not even harm the nature. Hope in the future we will see more applications of PLA. Now I would like to pass it on to Srishti.
Speaking of copolymers, what exactly is a copolymer? A copolymer is made up of two or more monomers. Current orthopedic surgical procedures primarily utilize autografts, allografts, and metal and plastic implants. Since these implants may lead to varied complications, various biodegradable and biocompatible polymers of both synthetic and natural origin have been developed for biomedical applications. They are fast emerging as metal implant alternatives. Polylactic acid (PLA) and polyglycolic acid (PGA) are the most extensively used class of polymers. The properties and tissue compatibility of PLA have been modulated by copolymerizing it with monomers, leading to formation and application of PLGA, PLCl, PLEG, etc. Now moving on to the next slide. Copolymers in bioresorbable plates and screws for clinical applications. Biodegradable polymers have been widely used as alternatives to metallic implants in orthopedics. Polylactic coglycolic acid (PLGA) is formed by the combination of polyglycolic acid (PGA) and polylactic acid (PLA). Both L and DL lactides have been used for copolymerization. By varying the ratio of glycolide to lactide for different compositions, its properties can be controlled. When the crystalline PGA is copolymerized with the help of PLA, the rates of hydration and hydrolysis increases. I would now request Abhishek to continue further.
Thanks, Srishti. So now I will be talking about that why the bioresorbable plates and screws are preferred so much in clinical applications nowadays. So let's start. The bioresorbable plates and screws are extensively used due to their superior biocompatibility and biodegradability. It has been found that the degradation time of the copolymer depends on the ratio of monomers used. That is, the greater the presence of glycolide units, lesser is the time required. Generally, the rate of degradation is directly proportional to the content of glycolide. PLGA is degraded by hydrolysis of its ester linkages in water. Its flexibility in degradation has made its use extensive in construction of many medical devices such as grafts, sutures, etc. There are some concerns about the potential aseptic inflammatory debris generated during implant resorption. Caminir, a copolymer implant of 82:18, which is the ratio of LLA:PGA, is used to fix distal chevron osteomies in 15 patients, and among them, only a single patient developed postoperatively a giant cell granuloma needing debridement. Andrews and his colleague surveyed a total number of 296 patients who were infected, and when this entire number of patients were evaluated, then only 146 among them received craniotomy fixation with titanium implants, and rest of the 150 received craniotomy fixation with a PDLLA copolymer. Along with that, 43 patients in the titanium group and 37 patients in the polymer group also received postoperative irradiation. Synthetic polymers have traditionally been used for the plate and screw systems in the orthopedic surgery, since the PLA polymer showed a slower hydrolysis rate compared to the PGA polymer in the human body. PLA polymer has mainly been combined with the PGLA polymer as a copolymer, which degrade by enzymatic hydrolysis. Thus, PLGA has mainly been used in the dentistry for synthesis of GVR membrane. In general, these bioresorbable membrane takes 4 to 6 weeks to start resorbing and has stiffness and duration as only drawbacks. The compositional change of the PLGA affects the hydrolysis rate and mechanical strength of the GBR membrane.
Now we will talk about the clinical employments of bioresorbable implants. Many scientists with their co-researchers have contributed to the use of bioresorbable implants in the clinical field. Fedorovich and others evaluated the effectiveness of bioresorbable implants used in orthognathic surgery. Adverse effects were observed in 2 plate exposures between the 3rd and 9th months and occurred mainly in the posterior maxillary region. Known causes of infection were associated with loosened screws and wound dehiscence. Eitenmuller and others investigated the suitability of polyl-lactide screws and plates for the treatment of ankle fractures. Fractures healed within 6 weeks, but 52% of the patients experienced an aseptic soft tissue problem raiding polylactide particles. Prompted by these problems, the authors treated 7 patients with volume-reduced plates and screws with flat heads, and none of the patients experienced any soft tissue reactions. The authors concluded that the use of polyl-lactide screws and plates is acceptable for the fixation of ankle fractures, and soft tissue inflammatory reactions can be avoided by using implants with reduced volume or biodegradable material. Deguchi and others evaluated the biomechanical stability of polyl-lactide pins in the posterior lumbar spine in comparison with other spinal implants, and showed that the polyl-lactide pin construct provided improved stability to the spine, although it was not as stiff as the screw construct due to the sliding motion of the pins during testing. Stevenson and others reported the use of biodegradable osteosynthetic materials in 50 children with transphysial or osteochondral fractures, 2 patients and non-union of articular radial head fractures, possibly related to a foreign body reaction. Haley and others evaluated the efficiency of polyl-lactide implants in 32 children aged 11 months to 17 years with 15 cases of craniofacial malformations, 16 cases of neurotraumatological lesions, and 1 case of refixation of an osteochondral flake of the patella. The follow-up time ranged from 3 months to 5.6 years with an average of 3 years. The stability achieved was comparable to that of metal implants. No foreign body reaction or local infections were observed, and it was not necessary to remove any of the resorbable implants. In a study by Epley and others, where resorbable polyl-lactide polyglycolide plate and screw fixation for craniofacial surgery was applied in 1883, in infants and young children, it was observed that device-related complications requiring reoperation occurred in less than 0.5% of the implanted patients, which is less frequent than the reported for metallic bone fixation. Significant infectious complications occurred in 0.2% device instability, primarily resulting from postoperative trauma occurred in 0.3%, and self-limiting local foreign body reactions occurred in 0.7% of the treated patients. The overall reoperation rate attributable to identifiable device-related problems was 0.3%. Andrews and Veznedaroglu studied the incidence of infection in patients after receiving craniotomy fixation with titanium and resorbable polylactide implants.
Here comes the comparison between titanium plates and bioresorbable implants. Bioresorbable plates offer clinical advantages over metal plates in orthognathic surgery in case of stabilizing fractures in a limited time requirement. Using titanium plates may require successive removal through a second surgery. Hence, using bioresorbable implants, second surgery will be avoided. Growth restriction or growth retardation may be applicable if metal plates are used. Thus, for young patients growing at a fast pace, bioresorbable implants are highly recommended. Titanium plates are limited by their palpability, mutagenic effects, and interference with imaging, which may lead to the need for subsequent removal. Several problems remain in case of metal plates, including fundamental issues involving decreased mechanical strength and stability, slow biodegradation, complex procedures as compared to the available bioresorbable implant materials.
Applications. Bioresorbable implants are used widely for fracture fixation in orthopedic surgery, and also the market is expanding rapidly worldwide. The main applications of bioresorbable implants are to stabilize fractures, osteotomies, bone grafts and fusions, mostly in trabecular bones, as well as to reattach ligaments, tendons, meniscal tears, and other soft tissue structures. The midfacial skeleton would seem to be an acceptable location for the use of bioresorbable implants, given the relatively easy access to fracture of this region and the low biomechanical stresses to which they would be exposed to. Bioresorbable implants have been also employed for management of foot and ankle fractures. Applications of bioresorbable implants in spinal reconstructive surgery have been reported. For example, polylactide screws were used for anterior cervical decompression and fusion procedures. Bioresorbable materials are also used in pediatric orthopedics.
Bioresorbable materials have been used worldwide over 4 decades for orthopedic applications. These materials continue to find use in novel applications such as sutures, screws, stents, scaffolds, and even synthetic skin. The main applications of bioresorbable osteosynthetic implants are to stabilize fractures, osteotomies, and bone grafts in oral and maxillofacial regions of facial bones. Bioresorbable implants of plates and screws systems are commonly used for various maxillofacial osteosynthetic surgeries such as orthognathic surgery, maxillofacial fractures, and reconstructive surgery.
So now we come to the conclusion here. The bioresorbable implants has a wide range of application, but among all of them, it has mostly expanded the armamentarium of the surgeon, basically in the field of sports and medicine. Instead of the widely acceptance, still many clinicians rely on the metal fixation. This is due to the high mechanical strength and complications reported in the comparison to the available resorbable implant materials. The bioresorbable implant materials as maxillofacial osteosynthetic plate systems should focus on the mechanical strength and bioactivities, bioresorption rate or speed controllability. And even for such customizability, and most importantly, it should focus on the reduction of the foreign body reactions and enhancement of the biocompatibility. Bioresorbable fracture implants are effective fixation devices offering significant advantages over the traditional metal implants. Their strength is retained long enough, which supports the healing of the bone and then disintegrated in the patient's body gradually and harmlessly. One of the most fascinating benefits of the bioresorbable implants is that it can be engineered to alter their material properties and degradation characteristics as per the requirements of the patients. There has been a great improvement and modification for optimal clinical feasibility for both patients and oral and maxillofacial surgeons and offer important advantages over traditional titanium metal plate systems. Based on the recent study of the biological and clinical reports, bioresorbable osteosynthesis systems are being widely and solely used for osteofixation in various maxillofacial surgeries, which includes the fragment fixation in maxillofacial trauma surgery and orthognathic procedures. The bioresorbable materials is updated to the third generation material of HAPLLA, which may be applicable for maxillofacial surgery because of its optimal and mechanical potential and bioactive osteoconductive bioresorbable characteristics. As stated earlier in this section, degradation and material properties of the bioresorbable implants can be engineered as per the patient's requirements. So, these bioresorbable implants can deal with the problems of the individual patients, and so it comes out to be a prospective and promising innovation of the era for the benefit of the mankind. And so by this I conclude our presentation, and hopefully we were able to make you understand each and every detail of the bioresorbable implants. Thank you.